I ask everyone who has watched the video to subscribe to my channel, and press the like button to continue publishing the best to you because I spent a long time making this video, and only on the phone. And don't forget to share the video with your friends, because it matters, and yourself and your families must be protected. I love you all. On December 31, 2019, WHO was alerted to several cases of pneumonia in Wuhan City, Hubei Province of China. The virus did not match any other known virus. This raised concern because when a virus is new, we do not know how it affects people. 1 week later, on 7th January, Chinese authorities confirmed that they had identified a new virus. The new virus is a coronavirus, which is a family of viruses that include the common cold, and viruses such as SARS and MERS. This new virus was temporarily named 019-nCoV. WHO has been working with Chinese authorities and global experts from the day we were informed, to learn more about the virus, how it affects the people who are sick with it, how they can be treated, and what countries can do to respond. Now I'm going to show you the top 16 countries with this disease. Australia has confirmed 5 cases of the virus. The most recent was a 21-year-old woman who was on the last flight out of Wuhan to Sydney before China imposed a travel ban. The other infections were detected in one man who arrived in Melbourne from China and 3 men in Sydney who had recently arrived from China and tested positive for the disease. They were being treated in isolation units in local hospitals. Cambodia confirmed the first case of coronavirus in the country on January 27. Health Minister Mom Ben Heng said the patient was a 60-year-old Chinese national in the coastal city of Sihanoukville. Canada. A man who arrived in Toronto with his wife on January 22 after visiting Wuhan has been confirmed to have the coronavirus. The couple were wearing masks on their flight from Guangzhou and took their own transport home from the airport. His wife has also tested positive for the virus. 19 suspected cases being investigated by health officials are from Toronto. China. As of January 28, at least 4,500 people have been confirmed infected across China, most of them in and around Wuhan. At least 106 people have died, nearly all in Hubei province, but officials have confirmed 4 deaths elsewhere, including 1 in Beijing and 1 in Shanghai. The Chinese government has imposed drastic curbs on travel to try and rein in the virus. It has also closed tourist sites at what is usually one of the busiest times of the year. The city of Macau, a gambling hub hugely popular with mainland tourists, has confirmed 6 cases. In Hong Kong, 8 people are known to have been infected, with hundreds of suspected cases reported. Hong Kong Chief Executive Carrie Lam has declared the outbreak an emergency, the city's highest warning level, and cancelled all official celebrations of the Lunar New Year. France. There are 3 known cases of the coronavirus in France, the first European country to be affected. A 48-year-old man is in hospital in Bordeaux. He had recently traveled to Wuhan and returned to France via the Netherlands. 2 others, a Chinese couple in their early 30s, had been hospitalized in Paris. All 3 had recently traveled to China and had now been placed in isolation. France's health minister has said it is likely that there will be more cases and that authorities are surveying all the people that the patients have come into contact with after arriving in France. Germany confirmed its first case of the coronavirus on January 28 in southern Bavaria. A man in the Starnberg region has been infected with the new coronavirus, a spokesperson for the ministry said, adding that the patient was under surveillance in an isolation ward. The ministry gave no further details on how the patient came to be infected but said he was in a medically good state. The ministry said it considers the risk to the general population to be low. Japan on January 26, Japan's public broadcaster NHK, citing the health ministry, said a fourth case had been confirmed in a resident of Wuhan in his 40s who was visiting Japan for a holiday. Japan's health authorities confirmed a third case on January 25. The country's health ministry said a woman in her 30s who lives in Wuhan had contracted the virus. The country's first case was reported by the health ministry last week, a man who had visited Wuhan and was hospitalized on January 10, 4 days after his return to Japan. Local media said the second patient was a man in his 40s who was originally from Wuhan and on a trip to Japan. Malaysia confirmed 4 cases on January 25. All were Chinese nationals on holiday from Wuhan who had arrived in the country from Singapore 2 days earlier. The most recently confirmed was a 40-year-old man who was being treated in hospital. A 65-year-old woman and 2 boys, aged 2 and 11, were in a stable condition and being kept in an isolation ward at a public hospital, Malaysia's health minister said. They are the wife and grandchildren of a 66-year-old man who was found to be infected in Singapore. Nepal said a 32-year-old man arriving from Wuhan had tested positive for the deadly disease. The patient, who was initially quarantined, recovered and was discharged. The government said surveillance has been increased at the airport and suspicious patients entering Nepal are being monitored. Singapore has 5 cases, all people who arrived in the city-state from Wuhan for the Lunar New Year holidays. South Korea. The Korea Centers for Disease Control (KCDC) confirmed South Korea's 4th case on January 27, saying that a 55-year-old South Korean man who returned from Wuhan on January 20 had tested positive for the virus. South Korea had reported its first case, a 35-year-old woman who flew in from Wuhan, on January 20. The second case, confirmed on January 24, was a South Korean man in his 50s who returned from working in Wuhan. On January 26, the KCDC said a 54-year-old South Korean resident of Wuhan who had arrived home on January 20 was the third to test positive for the virus. Sri Lanka confirmed its first case of coronavirus on January 27. The patient was identified as a 43-year-old Chinese woman from Hubei who had arrived in Sri Lanka as a tourist. He was admitted to the infectious diseases hospital. Taiwan has uncovered 5 cases so far, the latest a Taiwanese woman who had been working in Wuhan before returning home on January 20. The island's authorities have since advised against travel to Wuhan and Hubei Province and on January 24 said any arrivals from Wuhan would be rejected by immigration. All arrivals from the rest of China, including Hong Kong and Macau, must fill out health declaration forms on arrival. The territory has also banned the export of face masks for a month to ensure domestic supplies. Vietnam on January 23 confirmed 2 cases of the virus and a man from Wuhan who traveled to Wuhan City earlier this month and passed the virus to his son. Both were being treated in hospital and are stable, Vietnamese health officials said. United States. The U.S. has confirmed 5 cases of the virus, 2 in California, and 1 each in Arizona, Chicago and Washington state. Thailand has detected 14 cases so far. Sukhum Kanjanapamai, the ministry's permanent secretary, said on Tuesday all 6 latest cases are Chinese tourists from Hubei province who entered Thailand several days ago. They are from Wuhan. The new cases are 2 women and 4 men aged 6 to 60. 5 of the 6 new cases are family members. All 6 were admitted to a hospital in Hubei Province.